liters of oxygen, the mask is set. The vital signs are checked. The IV and the bag is connected. And the patient is being treated for shock. Yup. See, I'm not Dr. Oz, but the odds show a medic. Will ventilate after status post-epileptic. Oxygen levels are low with the devil. I'll perfuse your tissues through your blood vessels. I'll get your vital signs and then start a line and increase your capillary refill time. The airway, you're breathing, I circulate and go. What's the compression of breaths ratio? To automated external defibrillator shocks. End-stage renal disease from a kidney shock. Type 1 diabetics are insulin dependent. Blood pressure's elevating, hiking up your hypertension. Decompensated shock, you can die. The hit with 0.9% of sodium chloride. Pupils reacting to the light in your eyes. Anaphylactic scratches, you got hives. Like the death of Kennedy, he bled endlessly. Now a dead enemy from a head injury. Who else would be there when you need? Who control that bleeding when you can't breathe? And when you crash from excessive speed, that knife is 2 inches deep. Who got that IV and the painkillers? Who is there when your brain won't perfuse? Felt hit your head, got that bruise. Who was the first dude you saw when you came to? Who had you hooked up on O2 and them painkillers? Who else would be there when you need? Who control that bleeding when you can't breathe? And when you crash from excessive speed, that knife is 2 inches deep. Who got that IV and the painkillers? Who is there when your brain won't perfuse? Felt hit your head, got that bruise. Who was the first dude you saw when you came to? Who had you hooked up on O2 and them painkillers? Have any pain? Do you feel this? What's the mechanism of injury or the nature of illness? Head to toe assessment. Have any allergies? What's your medical history? It's the question. The medic, the trauma, the 30-foot fall. Leg stabilized and splits, head wrapped in gauze, bandages. Come on, man, call an ambulance quickly. You see flashing lights when it's misty. Yeah, it's me. Doing CPR, just starting IV. I'm that EMT with that oxygen therapy. Dehydrated, 310 milliosmoles. Asthma attack. Got that albuterol. I can stop your heartbeat and then bring it back. Strap you in my car seat and elevate your cardiac. Heart attack, V-tax faster than bagging after. Cerebral vascular attacks and fractures. Cool burn victims with that emergency service spitting. I'll stimulate your central nervous system and hit you with that morphine. Painkillers, just take 2 of these and call me in the morning. Who else would be there when you need? Who control that bleeding when you can't breathe? And when you crash from excessive speed, that knife is 2 inches deep. Who got that IV and the painkillers? Who is there when your brain won't perfuse? Felt hit your head, got that bruise. Who was the first dude you saw when you came to? Who had you hooked up on O2 and them painkillers? Who else would be there when you need? Who control that bleeding when you can't breathe? And when you crash from excessive speed, that knife is 2 inches deep. Who got that IV and the painkillers? Who is there when your brain won't perfuse? Felt hit your head, got that bruise. Who was the first dude you saw when you came to? Who had you hooked up on O2 and them painkillers? Painkillers. I was born in the Bronx, in Lincoln Hospital, in the coldest February ever in recorded history. Heart rate 168 beats, then I became an EMT. Anatomics the name, met a level respond to a 50-year-old male with abdominal pain. Take him to Lincoln General on Hospital Lane. I grabbed the med back with the stretcher and the oxygen tank. Sounds like Ringling Brothers, born on the Bailey Circus. This is an everyday purpose, more than a basic service. Step to this alien person, he said, I'm Brian Red and my mom's was a diabetic, so it's in my genetics. Took his vitals and did our assessment. He wore a colostomy bag and probably had to remove some intestine. Sitting for rest on the bench and dripping with sweat, clenching his chest and spitting up red, thinking he's dead. Interior incision, surgical, distal cervical, stage 4 cancer's terminal. Take him to the emergency room. Later on, I'll stretch your supine and legs up. Relieve some of the pressure, saving your life if you let us. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. It was pitch black, we were dispatched to Dead Man's Ridge. In the crib with 4 kids, grits for dinner and a bread sandwich. EMS run crazy in this neighborhood. A young ladies in labor and can barely afford baby food. Guided by the son, where's the mother? The daughter knows. Mom's on the floor, having contractions, her water broke. Calling for more back up there, sending me. I was in the bathroom, prepared for my first delivery. Waiting patient and proud and knee shaking it. Grounded, her vagina dilated, this crowning. I heard the baby shouting. This is one of those moments that we all share. Look it, we got a brand new baby girl over here. Mama cannot stand, let's get her to the ambulance. Here, hold your baby, know your baby is strong and brave. See, later on I stretch her, supine with her head up to relieve some pressure, delivering lives if you let us. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. Anatomic, catch a comet and defibrillate it. My antibodies will find the antigens and eliminate them. What happens when you hit them cigarettes? Can't catch a breath, cardiac arrest. Now EMS is pumping on your chest. No respect for your respiratory. First you go cold turkey, then I have to hear the second story. Hypertension with your heart condition, you're prescribed nitroglycerin. You might want to seek advice from a dietitian. You have challenges with your weight, hate salad on your plate. I hope they don't pick you up from dialysis late. My patient is critical, it'll be a miracle he's about. His line flows with minerals to keep him alive. Later on I stretch her, supine with his head up to relieve some pressure. We're saving lives if you let us. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic. It'll be a relief to breathe. Call EMS to come see on me, EMT anatomic.
Which is season respiratory distress, bleeding profusely from the mouth.
When the asthmatics need albuterol, that's my task. I ventilate apnea with my bag valve mask. I put the IV in his right AC. It's your blood type B or type AB. Cause of his diet, a medic treated a diabetic who was diaphoretic, hypertensive on diuretic. Staphylococcus aureus is resistant to antibiotics, but not to America's EMT anatomic. What happened? He's unresponsive. How long has he been down for? Help me lay him flat on his back. Go and check the carotid pulse for 10 seconds. You don't feel a pulse? We're gonna do CPR starting with chest compressions. 30 compressions.
From the collarbone area, which is season respiratory distress, bleeding profusely from the mouth.
I'm here to help you fight death with my breath. I used the eye test to identify life threat. It's amazing and fascinating when I'm saving lives, seeing your heart rate's elevated when I'm taking vital signs. Accessory muscle use is seen above the clavicles. If they're not breathing, then their breathing's agonal. They lose a lot of blood, their skin will feel cool when they're not breathing. Their skin looks real blue, pupils unequal in size, the head's got a bullet in it. Hyperventilate at 20 ventilations per minute. In that golden hour, time is precious. When I see bleeding, I go and hold direct pressure. Most common cause of shock and trauma, hypervolemic ecchymosis is a sign of internal bleeding. Assess a critical patient every 5 minutes. Anaphylaxis, your upper thigh need an EpiPen in it. Get the medical history on the asthmatic. Attacks happen, throw the oxygen mask at it. Glucose for ultra-mental status, hypoglycemic dizzy, 50 and 20 gauges in my IV kit for 4 injuries, whole spinal stabilizations. There's deformities, contusions and abrasions, penetrations and burns and lacerations. Intubate, ventilate agonal respirations, pulse toxins. Check oxygen saturations. Are you on aspirins? What you ask your patient? Asthmatics without inhalers. Pale skin is paler. Broke ribs and flail chest. Cyanosis in the nail beds. Extremity edema is a sign of heart congestion. Oxygen's correcting the shortness of breaths if unresponsive. Check the carotid pulse for 10 seconds. If circulation stopped, then start with chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Ventilate. 1 respiration. 2 respirations. 30 more chest compressions. 2 more respirations. For 10 seconds, check for a pulse. Alert emergency services and let them know CPR is in progress.
Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up. Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up. Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up. Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up. Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up. Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up. Area, which is season respiratory distress, bleeding profusely from the mouth. Hurry up.
Past the scaffold, found from face down in the gravel. Ejected from the car, how far did he travel? Skills clinical, I stabilize, germs are a real issue. So I sanitize, blood on pathogens, spreads and vandalize. Antibodies neutralize antigens, or there wouldn't be a man alive. Damn, I can't lie, if my hands ain't sanitized, it'll go viral. Chances for survival and vitals minimized. In emergency, I protect your cervical spine. Urgently, I get them to surgery, I'm certified. I'm trying to get the blood in your coronary flowing. If they can't catch a breath, I get pulmonary on them. Critical care units, ventilory, vascular, EMT, diabetes, relief medicine cabinets empty. Jetting down the crash course, ejected backwards. Black strap, strapped back down on the backboard, past the scab.
Bled endlessly from a head injury. We bled endlessly from a head injury. We bled endlessly from a head injury. Now we're dead enemy from a head injury. We bled endlessly from a head injury. We bled endlessly from a head injury. We bled endlessly from a head injury. Now we're dead enemy from a head injury.
Yo, past the scalpel, pull out the shrapnel. I stitch up stab wounds, even in the ball bathroom. On scene with the captain, grab the ready bag. If the bone's broken, you got one chance to set it back. Call a medivac, that's the helicopter. Drop you off at the hospital when you pop your neck and back. It's an emergency, hurry up and rush him to surgery. Faster than mercury, so fast we created burning heat. Kill germs in Germany, first on scene the incident. Before you hit the I'm dishing out that medicine, aspirating every gas aching. Your asthma exacerbated. This mask on your face, bag ventilation's epinephrine. I'll boost your adrenaline, your heart rate too high. Normalize it with adenosine. I'm trying to be the best known EMT, medical professional, rocking that stethoscope. Yo, pass the scalpel.
injury. We blend endlessly from a head injury. We blend endlessly from a head injury. Now a dead enemy from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. Now a dead enemy from a head injury.
Yo, past the scalpel, trauma is commonplace. Working overnights and thunderstorms on a holiday. Flipped him in a recovery position. He was unconscious with a concussion before intubated resuction. Gas sounds, bad bag, vial mass administrator, innovator, pulmonary saturator, ventilator penetrator with my IV injections. Ambulance operator flying through intersections. Responding to your life's crisis. Working nights just hypertension so high. Your eye drips right, my IV's right in. So what's your diagnosis? That bluish color, cyanosis. You're not getting enough IO2 this. Normal breathers on 15 liters pure oxygen. Vital signs monitored. I'm dropping in. Stay and play or load and go. I patch you up on the plane, cruise ship, or on skis in the snow. I don't wanna be a supervisor at Mickey D's with the supersized cup. I want to be an EMT life revitalizer. Yo, past the scalpel.
We blend endlessly from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. Now a dead enemy from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. Now a dead enemy 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 from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. We blend endlessly from a head injury. Now a dead enemy 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 from a head injury. 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 We blend endlessly. Now a dead enemy from a head injury.
Working with the team, we're restoring your health. Who's first on scene when you're calling for help? I study pathophysiology, biology, wow. Getting you to the hospital's my priority now. No apologies, there's no missing any abnormalities. Society's proud, EMS brought your vitality out. Who's that EMT responding to our emergency? The ladies having a baby, they trained me to make the delivery. What's immunodeficiency? After the emergency room, eventually you're being in care unit intensively. I'm efficiently effective, mentally electric, medically collected, professionally connected. Injected me with tetanus, anatomically symmetric, biologically antiseptic, criminally a medic. Who stabilized the C-spine and sterilized the CDC? I'm saving lives, America's EMT. Head and neck injury, the C-spine stabilized. America's best EMS saving lives. All my stretcher septic infected, I sterilized. America's best EMS saving lives. Pressures elevated, taking vital signs. America's best EMS saving lives. Managing, bandaging the bleeding, no wasting time. America's best EMS saving lives. Yo, pass the scaffold, take out the shrapnel. We found Tone face down, prone in the gravel. Got my scissors, check, next interventions. Best decisions by the best clinicians without med prescriptions. When I'm dispatched, I jump off the roof and fly away with the force that blow trees right out of my way. To land on scene, the team got IVs and fluid. If you're trapped in the car wreck, then we have to climb into it. After cutting off receptor section, if there isn't breath in the chest or pulse in the neck, the compressions and epinephrine. After baseline, vitals do the reassessment in case of readjustments. Head to feet, be aggressive. I don't need a doctorate to see the obvious that the patient can't breathe and need oxygen. Not a whiff of air came from the mouth again. Grab him by the chin, ventilate him with the light of wind. Who stabilized the C-spine and sterilized the CDC? I'm saving lives, America's EMT. Head and neck injury, the C-spine stabilized. America's best EMS saving lives. All my stretcher septic infected, I sterilized. America's best EMS saving lives. Pressures elevated, taking vital signs. America's best EMS saving lives. managing, bandaging the bleeding, no wasting time. America's best EMS, saving lives. I'm only trying to help you, advising you to manage your blood pressure or risk damaging your blood vessels. Let me take you on a trip through a dialysis clinic, 3 to 4 hours. It's a dialysis minute. People ingesting lethal injections, unprotected sex, cause vaginal outbreaks and penis infections. First on scene and not even speeding. First thing is to make sure they're breathing and then stop the bleeding. Intubate them. Professional abilities, resuscitate them on the way to the medical facility. Serotonin helps your brain deal with stress. Side effects of epinephrine is pain in the chest. Cardiovascular, 325 milligrams of aspirin. The blood in your coronary is backing up. 3 dentists walked into a bar. One felon had a heart attack. They called EMS. They didn't know nothing about the cardiac. The infirmary swole like the emergency room. Now urgency looms when surgery soon. Who stabilized the C-spine and sterilized the CDC? I'm saving lives, America's EMT. Please save my neighborhood. Please save my neighborhood. If anybody can save my neighborhood, the mayor could. If he doesn't, then my Lord and Savior would. I don't know how they caged the hood and enslaved a slew of people illegally in alleys. Every day I stood getting paid in full. In the drug traffic on the interstate, and Jake will look. I figured since I paid my dues, I'll go away to school. I'm breaking in boots to deal in real estate and suits. On my block I've watched Glock safeties loose. Shorty's chest plate got blew out, and from out the mouths razors flew. Lacing the scraper too, grazing the blaze, the face I do. Cribs are invaded through, chicks are raped on roofs. Teenagers too are packing nickel-plated nines with the laser zoom. For direct aim and boom, I get down on my knees and say my prayers to my Lord and Savior and ask him to please save my neighborhood. Please save my neighborhood. Any day I would help in any way I could. I get down on my knees and say my prayers to my Lord and Savior and ask him to please save my neighborhood. Please save my neighborhood. If my neighbor isn't up for favors, he shall get what a traitor should. It got to the point now I hate watching the crazy news. Please save my neighborhood. A real thug saying prove I deal drugs to make my loot. There's more ways to shoot a fake ass crew. Gunners running the streets with gauges getting caged in zoos. An armed robber with the 8 is like make a move. If I had Gates billions, I'd withdraw all my paper too and pay the Jews and buying back the hills that make my hood. I'll troop the avenues like saber tools to collaborate with crews about new businesses like clubs and Macy's too, and make more schools for our future lifesavers and creators too. Open doors for new invention breakthroughs. It'll make the news and daily news front pages too. I quote, please save my neighborhood. Please save my neighborhood. Any day I would help in any way I could. I get down on my knees and say my prayers to my Lord and Savior and ask him to please save my neighborhood. Please save my neighborhood. If my neighbor isn't up for favors, he shall get what a traitor should. It got to the point now I hate watching the crazy news. Please save my neighborhood. Please save my neighborhood. Any day I would help in any way I could. I get down on my knees and say my prayers to my Lord and Savior and ask him to please save my neighborhood. Please save my neighborhood. If my neighbor isn't up for favors, he shall get what a traitor should. It got to the point now I hate watching the crazy news. Please save my neighborhood. Please save my neighborhood.
Please save my neighborhood. Please save my neighborhood. Please save my neighborhood. Any day I would help in any way I could. I get down on my knees and say my prayers to my Lord and Savior and ask him to please save my neighborhood. Please save my neighborhood. If my neighbor isn't up for favors, he shall get what a traitor should. It got to the point now I hate watching the crazy news. Please save my neighborhood. Please save my neighborhood. Any day I would help in any way I could. I get down on my knees and say my prayers to my Lord and Savior and ask him to please save my neighborhood. Please save my neighborhood. If my neighbor isn't up for favors, he shall get what a traitor should. It got to the point now I hate watching the crazy news. Please save my neighborhood. Please save my neighborhood. Please save my neighborhood. In your mess, who? In your mess, who's here to relieve the pain in your chest? With nitroglycerin and 4 baby aspirins, albuterol for exacerbated asthma. Nah, do that. In your mess, who? In your mess, who have 10 years on the streets and from the best schools. I split your fracture fibula with a textbook. Now open there, EMS is here to the rescue. Walked into a room, she's in the tripod position, holding her chest and can't breathe, signs and symptoms. Take any meds with your medical history. Have allergies, you take a lot of antihistamines. What were you doing before you got this sick? Here's a mask of 100% of pure oxygen. Allergic to pollen, plus she's an asthmatic. She got cats crashing on the couch, wanting her lap cat napping. I put the stethoscope on the chest focus. Bronchioles are closed, get the albuterol, let's get them open. Put it in a nebulizer, create a mist, inhale it for 2 seconds, relax as you're exhaling it. After a minute now, she feel better, she's ready for transport. She can breathe better, see it's working perfect, the work of urban biology. In the back of my ambulance, starting an IV. Got your BSIs? Fine. First prepare your equipment, your line, 4x4s and alcohol pads, your gauge, Tegaderm and bag, your flush, tourniquet and tape. Check your fluid for clarity and expiration date. And with your line, spike the bag and squeeze the drip chamber to allow it to fill 1/3 of the way. Open the roller clamp and allow the fluid to fill the tubing. You don't want any air bubbles in your tubing. Now apply your tourniquet above the vein. Disinfect the vein in an aseptic technique with your alcohol pads. Stabilize the skin, holding your gauge no higher than a 45-degree angle. Now insert the needle until you see flash. Then push the catheter over the needle until it's on the skin. Press the vein above the catheter and withdraw the needle and dispose of it. Release the tourniquet, flush the tube in, check the vein for infiltration. Hopefully it won't infiltrate. Use the Tegaderm to protect the site and secure your line.
with tape. Sodium multiplies in the metabolism. Don't think about it, you'll catch an aneurysm. The liver stores sugar for glycogen. The atmosphere is 21 oxygen, 79% hydrogen. My ventilatory push your respiratory up. I'm your non-steroidal anti-inflammatory drug. Cardiac arrest, I get breaths and compress the chest. When you down 911, you get the best of the best. Note the deformities, abrasions, swells, or punctures, penetration, burns or cell ruptures, gangrene spreads, then the legs amputated, kidneys fail, the body collect more trash to sanitation. Generic pills are artificial like General Mills. Is anatomic, acidic, or alkalotic, respiratory or metabolic, with an anaconda and an antibiotic. The antibody's toxins. Knock, knock, who's that? EMS, who's here to relieve the pain in your chest with nitroglycerin and 4 baby aspirins and albuterol for exacerbated asthma. Knock, knock, who's that? EMS, who got 10 years on the streets and from the best schools. I'll splint your fractured fibula with the textbook now open there. EMS is here to the rescue. I'm gonna shout out Code 1 Training, Atlanta Tech, Citywide Ambulance, and Atlas Ambulance, and FDNY. I'm also going to shout out Rob $100 Million Wilson, Mr. Troy, Chandra, Paul Poppy P, Jay Cromarty, paramedics, Tanel, Nick, and Jason, EMTs. Peace. I give my breath to the breathless while I do chest compressions, EMS's confessions. Reassess my assessment, my best impression. Oxygen sat levels are low, her chest is congested. Operate, oxygenate, perfuses, penetrate like a 60 gauge IV infusion. Taking vitals, don't know AIDS is viral. Excuse me, sir, you're okay? He's laying idle with your knuckles. Rub the center of the chest and then pinch with 2 fingers on the flesh. He doesn't respond to pain, ultimate status, radio, medical, stat lights and sirens, emergency and traffic. I'm selfless, yes. Take a wellness test, hit the gym and keep your health in check. Intelligent, colder than 30 degrees Celsius. Filling you with fluids at the cellular level. We got a patient on cardiac and pain management. Ice pack 4x4 gauze and ace bandages. Intubated, ventilated, oxygenated. Yo, you're gonna make it. Check post motor sensory, treat the injuries, stabilize deformities, compare both extremities. Swallowing oral glucose, it's a sugar gel when hypoglycemia is your diagnosis. Taking high dosages of psychotropics mixed with street drugs. 10 years experience on these streets, son. Stabilize your spine, seat collared up. Epicat for ingested poisons, now bottoms up. So swallow up your epic gastric feels knotted up. Many urgent cares everywhere just popping up. You exhale carbon dioxide, veins flowing with oxygen, rich hemoglobin and sodium chloride. She's dizzy, they eased her to her feet, she passed out fast. She's not breathing, I'm squeezing a bag-bound mask. After work, I'm exhausted, nauseous, shortness of breath, coughing and convulsing, pulseless and dead. I go home late with abrasions and punctures. I work, rain, sleet, hailstorms, holidays and thunder. The hypertension with no lisinopril and no Benadryl. When your temperature feels elevated, but yo, you're gonna make it. He smoked fake marijuana, 2 defibrillator shocks. The Terminator shot the fake Sarah Connor. I'm in pain, morphine, lidocaine, more please, torn spleen, 1013, I'm insane. Medics to the rescue like land troopers and land cruisers. I hit veins with the ambulance moving. Jugular venous distension should be familiar, suggested. It could be congested heart failure. Advanced emergency medical
medical technician, bronchial constriction, stethoscope to your chest, listen, the breath's hissing, sound like the ref's whistling. If the breath's missing, then death's kissing. Two automated electrical defibrillator shots, CPR's alternated, ventilated when the pulmonary's not. 20 gauge IVs, an ordinary shot. A poetical heart attacks when your coronary's clogged. Hook them up to oxygen, administer the IV. To keep them alive, I drive at high speeds, tailing. You hear wailing, lights and sirens, fire rescues, police cruisers right beside me. Hook them up to oxygen, administer the IV. To keep them alive, I drive at high speeds, tailing. You hear wailing, lights and sirens, fire rescues, police cruisers right beside me. Medic 11, please respond to a labor on 7th Street. The rescue team delivered the baby and mom is 17. Airway, breathing, then circulation, skin's cool, paler, air perspiration, hypotension, high flow oxygen, chest pain, baby aspirins, and nitroglycerin hit the chest. Albuterol, cold hypothermia, laid out on a gurney after catching a hernia. Murderer killing germs like antibodies, mirror antigens that leave you stiff like a mannequin. My patient is panicking, you're okay, he ain't answering. Whip out the bandaging, wrap up the extra skin, stabilize the leg with splints. Drama in the city, trauma for EMT. I am a veteran, spitting Excedrin, prescription medicine, boost your adrenaline, should've taken your insulin. The heart muscle was dying, I electrified it, applied the electrodes, driving red lights and sirens. At high speeds on night streets, no more deaths tonight. Sodium chloride, electrolytes in my IV. The night penetrated 3 inches deep, stabilized that injury. Check the pulse, motor, and sensory defibrillated. Oxygen, administer the IV. To keep them alive, I drive at high speeds, tailing. You hear wailing, lights and sirens, fire rescues, police cruisers right beside me. Hook them up to oxygen, administer the IV. To keep them alive, I drive at high speeds, tailing. You hear wailing, lights and sirens, fire rescues, police cruisers right beside me. You can't detect the pulse, chest compressions before the bolts. 10 breaths a minute and then check the results. Cardiopulmonary resuscitations with automated electrical defibrillations, ventricular fibrillation. I make your heart stop in advance, call my vehicle the shock ambulance. Just when you thought it's finished, cells are replenished, medics invade your circulatory system like the British. Your heart pumps at a normal rhythm, oxygen perfuse your respiratory system. It circulates through every vessel, organ, muscle, and vertebrae. Illnesses germinate, there's a rise in the murder rate. Every day I earn my pay, save lives I work today, I'll make the sun hypothermic and then burn away. Hook them up to oxygen, administer the IV. To keep them alive, I drive at high speeds, tailing. You hear wailing, lights and sirens, fire rescues, police cruisers right beside me. Hook them up to oxygen, administer the IV. To keep them alive, I drive at high speeds, tailing. You hear wailing, lights and sirens, fire rescues, police cruisers right beside me. Painkillers. I give my breath to the breathless while I do chest compressions, EMS's confessions. Reassess my assessment, my best impression. Oxygen sat levels are low, her chest is congested. Operate, oxygenate, perfuses penetrate like a 16 gauge IV infusion. Taking vitals, don't know AIDS is viral. Excuse me, sir, you okay? He's laying idle. Take your knuckles and rub the center of his chest, and then pinch with 2 fingers on the flesh. He doesn't respond to pain. Altered mental status, Grady medical stat lights and sirens, emergency and traffic. I'm selfless, yes. Take the wellness test, hit the gym and keep your health in check. Intelligent, colder than 30 degrees Celsius, filling you with fluids at the cellular level. We got a patient on cardiac and pain management. Ice packs 4x4 gauze and ace bandages. Intubated, ventilated, oxygenated. Yo, you're gonna make it. Yo, check it out. Anatomic, pull the equipment out. IVs, oxygen, stethoscope, the stretchers out. Flying through the city, rushing to the ER. Performing airway management, wound bandaging, the CPR. So come with me if you wanna make it. First she's unconscious, unresponsive, now resuscitated. Check post-mortem sensory, treat the injuries, stabilize deformities, compare both extremities. Swallow oral glucoses, sugar gel when hypoglycemia is your diagnosis. Taking high dosages of psychotropics mixed with street drugs. 10 years experience on these streets, son. Stabilize your spine, see, collar up. Epicap for ingested poisons, now bottoms up. So swallow up your epigastric fills knotted up. Many urgent cares everywhere just popping up. You exhale carbon dioxide, veins flowing with oxygen, rich hemoglobin and sodium chloride. She's heaving, they eased her to her feet. She passed out fast. She's not breathing, I'm squeezing the back valve mask. After work, I'm exhausted, nauseous with shortness of breath, coughing, convulsing, postless and dead. I go home late with abrasions and punctures. I work rain, sleet, hailstorms, holidays and thunder. Hyper than hypertension with no lisinopril and no Benadryl. When your temperature feels elevated, yo, you're gonna make it. Yo, check it out. Anatomic, pull the equipment out. IVs, oxygen, stethoscope, the stretchers out. Flying through the city, rushing to the ER. Performing airway management, wound bandaging, the CPR. So come with me if you wanna make it. First she was unconscious, unresponsive, now resuscitated.